Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation. Hello, Megan.
Hello, Roxy.
How's it going?
It's going. It's Monday and it's 9:06, and somehow we still always late nighters. We had locker, I don't even know what I want to call it. Not really even meet the teacher because it's middle school, but like get your locker put together tonight. So
Okay, is that how it used to be where it's like, let's deck this thing out and put a mirror and snacks and decorate it, or no?
I don't really remember doing anything to my locker when I was in middle school, but last year I seem to recall there was this conversation from my daughter of like, we got to go get all this cool locker stuff. And then we went, and then she was kind of like, I don't know. I didn't know what was happening. And I know for a fact, though, she got this dry erase board last year. She's like, it's not going to fit. And I'm like, okay. And this year she's like, yeah, I need a dry erase board. And I'm like, this isn't going to fit in your door. She's like, no, it'll work. Sure enough, didn't fit in her door, but she put it on the inside. And luckily, the way their lockers are not that big. And so there's not a lot of space. There's some pretty sophisticated locker decor out there now, like magnetic LED lights and stuff.
Wowza.
Yeah. But she's not into that. So she just magnets and pictures and that sort of thing. So she got those there, and we picked up the school supplies that we pre-ordered this year, which made everything very easy. And I was super excited about. However, I didn't think about the fact that 8th graders like to choose what color of 3-ring binder they have. And so now I have 5 or 6 3-ring binders that she says she will not use. And I'm going to have to go get white ones or whatever, because they're like purple and red. And I didn't think about that. She was standing by her friend. I said, so are you going to use the binders? And Grace looked at her and she goes, yeah, are you going to use what they gave? And she gave us this like confused look. And I said, did your parents pre-buy the school supplies? And she's like, oh, no. And I'm like, that explains it.
Hey, well, I got on Amazon last night and tried to order Isla's like 3 things that we need, for preschool. It's like not your traditional. Like I have not toilet paper, the paper towels, all that.
Yeah.
I get in there to buy like glue sticks and whatever. I can't remember what else. Oh, a box of crayons. Yeah, they aren't going to be here till like 2 weeks down the road. That I'm thinking, are you kidding me? I could have ran into Dollar General, but I specifically got on here because I have Prime. Evidently, everyone's buying those things, and they are low stock. So
I know
note to everybody.
Yeah. Well, speaking of Prime, I have a bone to pick. We ordered this big old box of creamer for the clinic, like the little, individual ones. And we've done that before. And it was going to get delivered. We were out of town and we saw the person come up on the Ring cam, and then they left or whatnot. And then we had a thing on our door that said that they tried for delivery, but that we needed to pay $29.95 in shipping. And I'm like, what? I have Prime.
Sometimes those will get you if they don't say Prime on them.
So then I can't remember. We got another notice, and I could have sworn Nathan said it was maybe at the clinic even. I don't know. And anyway, there's the thing that's left, there's like no number to call, no nothing. So
just got to pay your $29.95.
We are not paying our $29.95. We were telling him to send it back. So anyway, and then tomorrow night we have Meet the Teacher night for my son. So lots going on. And then school starts on Thursday for him and Friday for Grace. So it's a busy week. I signed up today for the parent team's general sign up.
Good for you.
Because I am committed and I'm going to do more this year. And so this sign up makes it so that you just are given all the information of the events, and that then you can pick versus signing up for one specifically. So I'm going to try to do better, because the realization that Grace is going into the 8th grade has me speechless. And she's turning 13 on Friday. So
Oh,
I know
she's gonna be a teenager.
she's going to be a teenager. Oh, and little update
Oh, yes.
last episode, we talked about her starting her cycle and all the things. And I'm here to report. I honestly didn't think she'd probably have a cycle for a couple months because it was just long and heavy and all the things. She started her second cycle and it was like 32 days from the last one. So we had it on a calendar and we counted and I was totally impressed. So she didn't have any cramps leading up to it, but after she started, she said, I kind of, that feeling. I just told her she just kind of had it, she's on summer break, so she's not doing too much. And then Owen told me that I was leaving that day. I had a conference to go to, and he informed me that Grace didn't feel good, but he would take care of her while I was gone. So
Oh, little
he
brother
went,
stepping
I
up.
know. He went and got her the heating pad. And then I told her when she was going to bed, I said, you need to put your hands over your ovaries and your uterus and tell your body thank you because it's doing what it's supposed to. And she goes, I know. I'm laying here right now with my hands over that area.
Oh,
Oh,
Grace.
so I know it's good. And just like I said, okay, mark it on your calendar. So we're learning how to track right away.
Cool.
So cool stuff.
All good. All good.
All
Well,
good there. Yeah. So Roxy, tell us that was kind of all my stuff good. There's just
yeah.
lots of fun things going on. So what about you? You
I
got
was,
school supplies from
yeah.
Amazon.
Hopefully we might have to make an impromptu trip to get those stinking glue sticks, but dang it, we're getting there. So, yeah, she starts preschool on Monday, all day preschool. So she's deciding if she wants to pack her lunch
Oh,
or
yes.
eat school lunch. And
This is important.
right now she's wants a mix. And I said, that's great because even if we committed to sack lunches, the chances of us getting a sack lunch out the door every morning is probably slim. So we're gonna put some money on that tab so that
Yep.
the bags.
Yep. Load them
So
up.
yeah, but no, that's good. I had, this evening I had a friend come over from PT school actually, and it was just kind of nice. Her boys came over and
Fun.
actually we just did a little bit. I did some little abdominal work on her because she just is having some abdominal struggles. So anyway, I did that, but then we just went on a little walk and her kids and my kids just played and it was just fun. She has two boys and I have two girls, so it was fun to just like compare and contrast and have just those differences of boys versus girls. But just one of those friendships that like, do you have any of those friendships where you don't try really hard, but somehow you just keep brushing shoulders or you keep kind of
Yeah.
coming back together? And it's not because either one's really trying really hard. It's just like, huh, here
Yeah.
we are. And
Yeah.
I appreciate you. And,
Yep.
I
Yep.
kind of like that type of friendship. So I don't know. I'm just
There's
feeling,
not a lot of pressure to,
yeah, yeah.
yeah, but you're always there.
Yeah, just grateful for that friendship. I think I'm feeling that this evening, just kind of feeling
Yeah.
full. So,
It's always nice. Yeah.
yeah.
A little change in the normal routine.
Yeah. Yeah.
Yes.
Well, tonight we're going to talk about something very different than menstrual cycles.
Yeah.
We're going to talk about the feet and how your feet and the health of your feet can in fact influence the pelvic floor and how the pelvic floor functions. And if you're leaking or have pain or whatever, there can be a lot of good in looking low down at your feet.
Yep. It's something that it's easy to overlook.
It is easy to overlook. So what brought this up was just our conversation about some interesting patient cases that we've had lately. And I've actually had a couple, and this isn't like new news to Megan and I necessarily, but it's just easy when we're working with patients. Man, this is really like we say this a lot, but head to toe, we're doing head to toe evaluation, but man, that's a lot. That's a lot to look at.
Yeah.
That's a lot to be, assessing. We're not just looking at the pelvic floor, even though that's like we have like pelvic floor goggles on, obviously, of looking at everything through the lens of the pelvic floor. But I have a couple patients, and one in particular lately that just very strong and active individual and has had, kind of middle aged, I would say, and has had some leakage. And started seeing me, and this person does everything I ask. We're working on all the things and just still like has leakage, very almost predictable, but she can do like box jumps and she can do
Yeah.
burpees, and that's
Yeah, that's high
fine.
level.
Yeah, and that's totally fine. But then like she's running, and it's like she then has leakage, and it's like we're
Mm-hmm.
just not beating our head against the wall, but it was just she's doing all the right things, and we're
Mm-hmm.
just kind of start we making good progress, but then it's just this lingering thing. And
Mm-hmm.
goodness, we started looking, and it really came down to her feet. And so we've been working on her feet, and it's like makes a difference in how her body moves and how her body compensates. Our bodies are really beautiful, even if each individual piece isn't working right. So in her case, her ankle and her foot isn't super mobile right now, but like the woman is a beast, like
Yeah. Yeah.
she did a pistol squat for me, like, but it's like the mobility, all of a sudden it's like, oh, that's not right. That piece of the puzzle is not working right, but all the rest of her body made up for it.
Yeah.
And so the pelvic floor then is compensating too, and it's gripping and it's helping and it's trying to kind of help out in that way.
Yeah. It is so fascinating how if the foot isn't moving correctly and accepting force correctly, how that can affect so far up the chain. And I would agree. I was just talking with somebody today about when we say like treating the whole body and what that means. Cause I regularly, yeah, yeah, a lot of people say that. But truly, when you work on all the things, and like Roxy, you're just saying, like you're like, there's just one piece, like this one piece keeps just not, there's something there to be able to look down. I mean, that's so cool that you saw that and you're like, oh my gosh, look at all this restriction there. So what sorts of things have you been doing with her?
So she does not have like her arch. She doesn't have good stability through her feet. So when so we're working on like stability and weight bearing, because really like if we just tried to like TheraBand our way through the end of it with open chain stuff, it's not going to
Hmm.
work.
Yeah.
So we've been
Yeah.
doing a lot of like foot stability and standing. We're working all the way up the chain. So hip stability too is kind of a
Hmm.
big thing that she's really put a lot of effort into. But we're working a lot of mobility. I've been mobilizing her ankles and her big toe and her
Yeah.
fibular head, like all the way through all that.
So cool.
It just is neat then to do kind of a test retest and see, oh, like, and she'll even say, oh, that feels better. Like that just feels
Yeah.
a little freer. It's not perfect, just one shot. We're
Yeah.
not gonna, I mean, this is probably years of compensation and stiffness that her body just has figured out how to deal with. But it's clearly not working great for her because she's having leakage, and that affects the whole chain then. What we could really see then is when she would do like a anything one legged, like squat or like a step down or anything like that, her whole pelvis and
Ah,
spine would drop instead of the weight bearing
yeah.
leg like descending down, and then it
Uh-huh.
all came down to her ankle wouldn't bend enough.
Yeah.
So like her body would make the movement happen. And so she could do all the things.
Yeah.
If you just asked her to do the task, she could do it. But then when we looked at it, like then the hip wasn't working well. The stabilizers and the glutes weren't actually doing their job. And so then the pelvic floor is tighter on that, especially on that one side,
Yeah.
restricted. So then
Yeah.
it's not a trampoline, it's not absorbing shock. So when she runs, it's resilient for a part of it.
Yeah. For part of it. And then it's like you hit that point.
Mm-hmm. And then I think, even as we, so then it's like, well, how does that relate, or why isn't it not bad in other times? But, when she's doing like box jumps or things like that, she's bilateral, and her body
Yeah.
can then compensate or like pick up for that slack, or it's not in the depth, it's not as deep, or she can
Yeah.
boing a lot more with maybe like through her knees and her hips just a little bit versus her ankles. It's really beautiful. I think, I mean, I know I've said this before, but I think a body that's not functioning perfectly, I think is really fascinating to say, oh, wow, our body's really beautiful and that one area isn't working well. So the rest picks up. But it's really kind of fun then to like deconstruct that and say, oh, let's make this better. And then I want you to, so we'll mobilize and then I'll have her do, we'll do some stretches and I'll have her do some weight bearing things then so that we re-educate then that joint in
Hmm.
how to move then with this range that it hasn't had for a while and
Right.
how to move differently. And then we're really promoting then all the way up hips. Like how does your glute, how, do you feel that, we have a really work through some of that strength and
Yeah.
ankle chain. So,
Well, and you even think about like, and not even necessarily just single leg, but doing like squats. If someone's really restricted with their ankle dorsal flexion and they don't have that mobility there, how they start to kind of collapse
hmm
medial, at the knee. And then you can just imagine this, like seeing somebody do a squat and then there's this collapse that happens. And so you think, okay, if that's happening there, and then what's happening at the hips? And then, okay, so whatever those hips doing, the pelvic floor is sitting there thinking, okay, well, how am I going to respond to this movement? But therefore, it's like, okay, well, if you jump to hip strength, you're doing hip strengthening and you're still not looking at the movement of at the ankle, you still potentially are going to be missing really more of that root cause.
hmm
And I mean, I think it's safe to say, I mean, the majority of people really do have calf tightness. And that's something that, gosh, I remember one time Abby was working on me. And just so you know, if you ever want to get me a gift, it's a massage for my calves because I love my legs being rubbed. To the world out there. It's something I struggle with myself personally. And I have like overpronation, but she often, when we're working with the patients, if we're doing some spinal work or something like that, we'll also stretch like hip flexors and quads. And then but while we're doing quads, we'll grab a hold of the foot and we'll stretch the calf and we'll kind of squeeze the foot, mobilize the foot, kind of rub. And I think some people think if they're watching, they're like, oh, they're just giving them a foot rub, but there's a purpose to it. And the amount of people that are like, oh my gosh, that is the best thing ever. And it's purposeful, because they
hmm
don't realize it. But I mean, I get a hold of somebody's foot, you can barely move their big toe. And that's important mobility that we need to be able to walk and run and that sort of thing. So, and it is something that's just not talked about all that often. And it's not necessarily the first thing that I will say I even go to.
Sure. Yeah. We worked on a lot of other things first.
First. Yeah, it's so important. And this is probably a good reminder.
Well,
Like,
yeah.
look
And
at
well,
the,
and she made good progress.
yeah.
But, I think it is that one thing where I was like, I'm not okay with this. And
I
she also was
know.
like, what are we, where, like I'm
Like,
doing all
what
the
is
right
this?
things. Yeah. Like we were both
Yeah.
just, I think too often we settle, and
Oh,
say, well,
yeah.
like we've made good progress. At least I'm not doing it this much or this often or whatever. But
Yeah.
we were
Yeah.
both like, okay, let's keep diving. Let's keep figuring
Yeah.
this out. And so that was nice to have. I mean, that just was really refreshing too, to have someone like really wanting to
Yeah.
dive into that since it wasn't our first go-to and we had made good progress. One thing too, that we have to recognize is that we talked mechanically of, if the ankle's stiff, then that causes a change in how the knee and the hip and the pelvis and the spine even all work. And so when you were talking about hip strengthening, we can strengthen the hips all day long, but if then in day-to-day life it never accesses that range or that new
Right.
strength that you've gained, then you're not doing anything. I mean, I think
Right.
that's just a testament to say, oh, there is validity and you can be doing all the right things. But if you're not seeing change, then there's a missing piece that like, let's figure it out because it's
Yeah.
probably there. But the other thing I was going to say is then neurologically is that our sacral nerve goes clear down to our toes. And our sacral nerve is, our 2, 3, and 4 keep pee and poo off the floor. So that's like really like our bread and butter. So that goes clear down to that big toe. And so we can, from a nervous system level, we can be working on the nerves. And there's a ton of research right now that if we stimulate down on the leg with a TENS unit, that can help with urgency because we're working along that same nerve. And it's
Hmm.
like, this isn't voodoo, it's just anatomy. And it's just
Yeah.
saying, oh, that's irritated up high. Let's work it down low. Let's do some things down low on that same nerve. Let's give that nerve some input so that then the brain's clicking and it's really aware
Yeah.
of what's going on there. And I think that's always really fascinating to say, like, is this real life? Like, can this actually help? But it can.
I'm still laughing over here. I don't think I have not heard that say.
Oh
From
gosh.
PT school was C, what was it? C3, 4, and 5 keeps the diaphragm alive.
Yeah.
I've not heard
Three,
S234.
four keeps pee and poo off the floor. That was my folks, that was my introduction to pelvic floor
Oh my gosh.
education.
I
That's all I
love
knew.
it.
That's all I remember from PT school about the pelvic floor.
Yeah, it is so interesting with the nerves and where they innervate and how you can use TENS units or other sort of manual work to address nerve roots and how symptoms, get better and improve. And again, like if you're not having somebody look at that or take that into consideration, not necessarily like as we were talking, like, using the TENS unit down by the at the nerve, but if you don't have somebody, if you're not seeing somebody that can take in consideration the neural input component in general, I mean, it could be anything, even if you wanted to just talk more orthopedics, you're missing a big piece because it is such a very important layer. If you think about, you got muscle tension, which is going to cause more compression on nerves, more compression on vessels. Fascial tightness is going to do the same thing. Then you're also could be affecting lymphatics. That's why, hands-on work is important and easily overlooked. But I was also, so going back to exercise and foot and ankle and stuff, I had somebody that I was looking at, kind of a similar story. And that's what we're starting to dive more into, kind of more of like what's happening with impact and at the ankle and the foot and all the things. But even just looking at like I think that the lay individual, when you go work out or you do these like boot camp classes, you're just going to go hard and fast. And depending on what your personality is too, you might just like go, like, you're just like doing this as like quickly and as hard as you can. And I had somebody like jump rope for me and show me what they look like when they jump rope when they're at boot camp. And I mean, it was like, there was no finesse about it. It was just like boom, 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 boom on the ground. I'm like, okay, first off, let's slow down. There was no, breath was held. There was a forward lean. So we had this pressure down. The feet weren't really moving. They were just staying still. So all those components can play a big role. And that's what's kind of cool about it is sometimes we just need to see you do the movement and we can make those modifications and then suddenly that leaking goes away, which is nice because sometimes it doesn't, it's not like it's always really fun when you're doing something and sometimes you just make one or two adjustments and 2 or 3 visits and voila. Then they're like, what? That was it? That's not always the case, but it is pretty cool.
All right, Megan, let's jump into just some pearls, some clinical pearls for people to take away from this conversation to optimize their feet, to optimize their pelvic floor.
Yes. So these are just general.
Yeah.
Everybody
what's
could
your
do
number
this.
one, or what's your first one you're going to throw out?
Well, the first one I'm going to throw out is I'm a huge, huge believer with the wide toe box shoes. I myself personally, if I wear, man, I got to get me okay, I'm not to the point where I can wear like the barefoot shoes. Shout out to our OT pelvic floor queen Paige. But she is all about she's got some good information on the foot.
Fact. That's fact.
Yeah, that's facts. But so I can't wear the barefoot shoes. I would have to really work into that. But I like a good wide toe box. I prefer something like a New Balance that has a wide toe box. Lets my foot move. And when I wear anything that does not allow that, my feet and my ankles hurt. So a wide toe box.
From Paige's advice, got myself some toe spacers. So that's mine. And I didn't realize how tightly my toes are all put together. But man, when I wear those toe spacers, it's like I have a new pair of feet, a new set of feet.
Okay,
I can just tell a difference. It's not super comfortable right away, but working into it just in the evening, sometimes I'll pop those suckers on and it just spreads your toes out and it's almost like a breath of fresh air for your toes.
It's like,
But yeah, no, that's a good just thinking about letting our feet be how they were made to be, which isn't mashed together and really tight, but it's being able to have room and space to move. And so those are kind of not one and the same, but they're vibing on the same idea.
They are. Yeah.
Yeah.
It'll help with stability too, with being able to like splay your toes.
Mm-hmm.
So probably our next thing, we're kind of just like layering these on, is obviously like toe yoga or, stretching to the bottoms of your feet. But like toe yoga in particularly, there's like some different exercises to do where you try and like keep your toes down and raise the toe up, that sort of thing. It's kind of hard to coordinate.
It
It's
is.
hard when you first start.
Can you do the big toe and keep the littles down, or do you mash the big toe down and lift your
Okay,
others up?
so
What's your
let,
dominance?
let me sit here and do this really fast. Okay, everybody take off their shoes and their socks and put their feet on the ground. Try to hold your toes down to the floor. No, try to keep all your little toes
And lift your
on the
big toe
ground and
up.
lift your big toe. And I guarantee you'll probably try to move your hand at the same time. Okay, I can do that.
I struggle with that. I'm a little toe lifter dominance. That's the
I
thing.
can do it. It takes me a lot of brain power at first, and then once I get it. But when I do that, I want to like move cross my fingers at the same time.
Yeah, it takes some work.
It's
Yeah.
like you stick your tongue out when you're like, working really hard, like it's gonna help you.
Cross those fingers, it'll help. Yeah, but just getting a little that toe mobility and
Yes,
being
Tom.
able to
Yeah.
have those toes move freely
Yeah.
is really helpful. And if you realize that your toes don't move very much, you might just reach down and stretch them back.
Yeah. Yeah.
And so that they like pull them towards you. Nugget, your big toe, you should have 90 degrees of flexion. So if that sucker, if you can't pull it back to a 90-degree angle, start working on that bad boy and get that thing moving a little bit better. So when you walk, you can actually push off and your pelvic floor will love you.
Yeah. That's the one nugget. And your pelvic floor will love you. Get the big toe to 90 degrees. Yeah. And you know what? When you start doing some of that toe yoga stuff, the bottoms of your feet might get sore. And that's expected because you're using the little intrinsic muscles of your feet. And it's just something that we don't think to exercise them, even though they're working for us like nonstop. So obviously, we would say calf stretching. You want to stretch your gastroc and your soleus. If you don't know how to do any of this stuff, just come see us, okay?
A good foam roller or cork ball or something too can be good for the backs of your legs or the arches of your feet. That can be kind of
Yeah,
along with stretching. You can kind of roll.
roll a little bit. I have, yeah, like mentioned, I have historically tight fascia and everything just down around my ankles. So I have put on the silicone cups before
Mm.
on my calves and put them on and kind of left them on. It's definitely pretty painful to move them around down low because there's not a lot of tissue and it can pinch really bad, but just to try to help increase blood flow and that sort of thing. So that's helpful. And then obviously, we want to strengthen our gastrocs, our calf muscles, because typically the reason why they've gotten tight is probably because somewhere along the lines it got weak too. So those are our like nuggets of keeping yourself mobile
From the
in the
bottom
ankle
up.
from the bottom up.
Any last words?
Roxy's all with the little nuggets tonight.
Final one liner. Shoes are tools, not jewels. Pick 'em wisely.
Shoes are tools. That is right. Speaking of shoes, I'll get us off on a tangent here. We had to get back to school shoes. And my kids don't care about if the toe box is wide or not.
Hey, do I need to
Anyway,
come and give them a lecture on tools
yeah.
versus jewels?
So listen, they ended up getting the same pair of shoes. They wanted these Nike Blazers. I had no idea. Nike has a new shoe all the time. I don't know the difference between Nike Airs, Nike Dunks, Nike Jordans. Actually, I do know what Jordans are, but that's because that's back from my day. But in Nike Blazers. So, and this is the first year that Owen cared about what his shoe looked like. And let me tell you, they are not a wide toe box and it's killing me. So then also, I did get him a pair of New Balance.
That he'll never wear. Let's
Well,
be honest.
actually, he has to because they have a new gym at their school. And when you get new gyms, they like to make sure that you have shoes that aren't going to like get it
Make
all
marks.
make marks. And so he has to have gym shoes. And so those are going to be his. So he'll wear them every day.
There you go.
Yeah. And by the way, they were on clearance at Shields. And so I almost wanted to buy two pairs. So, yep. Hopefully, this was helpful. And if you're like, dang, my feet are tight, get to moving them.
Yeah. And if you're having pelvic floor dysfunction, There
Yeah.
could probably is a connection.
Yep. It's connected up to the jaw and it's connected down to the feet. So there you have it, folks.
Hey, until next time, we'll keep this conversation going.
Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.